I've been a medical doctor for 23 years. I was trained to diagnose ailments and treat symptoms. I eventually realized that a more holistic approach was not only needed, but crucial in treating patients as a whole. Now, as a medical doctor, I saw firsthand the limitations of medical treatment. It was able to control my symptoms, but unable to address the psychological consequences. Years ago, I had symptoms of reflux that induced anxiety and panic attacks that continued long after the reflux had subsided, and the pattern just continued. This is when I first stumbled upon hypnotherapy. I understood that by creating a focused and altered state of awareness, the unconscious mind could be accessed and negative thought patterns could be replaced by positive suggestions. In virtual therapy, you are able to reach far and wide because there's no boundary, there's no interstate boundary, and there's no international boundaries. Affordability for the therapist. You don't have to pay a rental for a space or hire staff that you need to run the practice. So you can do it from the comfort of your home with a good internet connection and a computer. One of the cases that I saw was a patient who was just discharged from ICU. He was admitted for liver abscess, and the abscess had spread extensively to other parts of his body. So he was in a lot of pain. And when he called me, he was very distressed, and he could not even get himself to see me on video. He wanted a session on audio, and I thought it was challenging. But when I went through the session with him, I realized that not only was it easy for me, but it really worked for the patient as well, in the sense that it made him feel less stressed, made the pain bearable, and made him feel optimistic. Clinical hypnotherapy sets a platform to address and assist patients to manage psychological symptoms by working on the unconscious mind.
We are paving the road for clinical hypnosis in Malaysia and beyond. Together, let's build a society that values mental health.